Hello, my name's Philippa Woodward, Dr. Philippa Woodward. I'm one of the GPs at PRIME Health, and I'm having a chat with my colleague, Dr. Nichol, today about the prostate gland. So Cam, you're going to hopefully start by telling us what the prostate gland is, where it is, and what it does.
Yeah, absolutely. Firstly, my name is Dr. Nichol. I'm one of the GPs at PRIME Health, and I think we're really well placed to offer a good service for our patients to ensure that your prostate health, if you're a male, is in really good nick. And we're also there to pick up anything should it go wrong. So the prostate, I think let's go really back to the basics. It is a sort of walnut-sized gland that sits in the male reproductive organ. It's around the tube where we wee out of. And the main function of it is to produce a fluid in the ejaculate. That's its main function. We want it to be healthy so that we have a normal, healthy ejaculate. We don't want it to be too big. That can cause issues with urination, with weeing. And one of the risks that we always want to avoid is anything sinister happening with the prostate gland, such as prostate cancer. In between, sometimes it can be inflamed or infected. That's called prostatitis. And so if you're getting some niggling symptoms down below, it's always very useful to come and have a check and make sure everything is healthy. Speaking about prostate cancer itself, it's a really important disease to catch early. So we know that 52,000 men in the UK are diagnosed with prostate cancer every year, which is around 144 men a day. The good thing is, if we catch it really early, the outcomes are very good. So as part of normal health screening, if you're a man with a prostate gland, prostate screening is really important.
Okay, so what symptoms, if I was a man, should I be looking out for if I am concerned about my prostate? What are the things that should alert me to trouble?
Yeah, good question. So there's lots of things that we would like you to come and speak to a GP about. Things to do with urination, so difficulty in passing urine, if you're straining, if it's finding it difficult to initiate your flow, if you've noticed your flow has changed, so if you've got a slightly weaker stream than normal. Sometimes people describe something called urgency, feeling like they need to go but just can't quite do that. The other thing that we sometimes think about is if we've just finished urinating and then we have a little bit more of a dribble, that would be important to come and see us about. Other things that people like to make sure that they're keeping on top of are weeing at night. So we would call that nocturia. So if you're weeing more than normal at night, it's really important just to get checked out to ensure everything is nice and healthy. Equally, other symptoms that we sometimes think about in men, if we're having some unexplained weight loss, if you've got a family history of prostate cancer or those sorts of issues, we're getting unexplained back pain or pain and uncomfortable feelings down below. Those are all symptoms that we would like you to come and see us so we can have a discussion, we can examine you, and we can talk through what we do as next steps.
So you mentioned that people who've got a family history of prostate cancer are at increased risk of prostate illness. Are there any other ages or groups of people who are maybe more likely to get prostate illness?
Yeah, so the big four, as I always like to offer to my patients, if you're over the age of 50, you're at slightly higher risk of having prostate cancer. If you have a family history of prostate cancer, direct relatives, we would go through that in a consultation. If you're from a Black ethnic background, we know that there's a higher what's called prevalence or a higher chance of you having prostate cancer. And then the last one, which people often forget about, is actually if you have a close relative who's either had breast cancer or ovarian cancer, there's actually a crossover genetic link with one of the genes called BRCA that you might have heard of. So if you've had a relative, a female relative who's had breast cancer or ovarian cancer, it's really important just to ensure that that prostate health is nice and normal.
If I came to see you, what would be the tests that you could offer me at PRIME Health to make sure that my prostate was healthy?
Yep. So I think at Prime, we're really well placed where we have a lot in one space. So what I mean by that is we have X-ray, ultrasound, MRI, CT scan, all on site in our consulting rooms, next to our consulting rooms from our GPs. That's brilliant because we have those scans ready to go should we need them. But actually, before we talk about scanning, there's a lot more that we can do to assess your prostate health. And the bread and butter of any GP is taking a really good detailed personal history. So it will take a skilled expert GP 10, 15, 20 minutes to take a really solid history to tease out all those risk factors, some of which we've already discussed, but trying to apply all of our knowledge as it relates to you as the individual in front of us. So we would go through all of your medical history, and then we would talk about what we do next as next steps. So there could be things like, do we need to do a physical examination? We often refer to that as a digital rectal examination, where we feel the prostate, inserting a gloved finger into the passage, making sure it's smooth, it's not irregular, it's of normal size. We can also offer blood testing, and we can do that as part of an initial appointment if you choose to. Most of the blood testing that we do when we look at prostate health is something called the prostate specific antigen, or the PSA. And that's been in the news recently as an important blood test to get done. We're also really well placed at Prime to be able to offer a more detailed and more accurate blood test, and that's called the Stockholm 3 blood test. That is a more accurate way of looking at a few different things: a protein, some genetics, and it also bakes into a clever algorithm your personal history, and it gives a very accurate reading as to whether or not there's any risk in the prostate. I think from the top of my head, looking back through the research, that's been done in about 90,000 men, and there's been 30 published studies on that test. And we are telling patients, after the advice given to us from the doctor's lab, which is one of our labs that we use in London, that if we have a really reassuring result from that Stockholm blood test, we can have several years of reassurance before we need to retest. So that's all of the stuff that we can do before we even get to imaging, but very happy to speak more about what imaging we could consider as next steps as well.
So with them, if we did a straightforward blood test, a PSA, are there any extra bits to that that will help us to highlight men who maybe have got a large prostate and therefore a high PSA simply due to the size of their prostate, or men who have got a smaller prostate but with a malignancy within that prostate?
Yeah, so I think you're alluding to the ratio, or the prostate ratio. Yeah, so one of the good things that we have in our the lab called the doctor's lab, or TDL, is we get a lot of lovely bits of information. So as well as the pure reading of the prostate specific antigen, it also gives us a ratio. And I won't get too far into the detail with the numbers, but essentially that gives us more information to do exactly as you say, which is one of these is a false positive reading, which is it's just raised for some reason. One of these readings is to do with something that we need to investigate further. And it just gives us a lot more information than just a pure PSA test.
So we can filter out the patients that may require further investigation, such as the Stockholm 3 blood testing or the scans.
Absolutely.
And there are two different types of scans that we can do at Prime Health, aren't there?
Yep, so we tend to offer, in terms of an investigation of choice for imaging the prostate, we would use MRI scanning with discussion with our consultant radiologists, so the sort of X-ray clever imaging doctors, and also our consultant urologists, all part of the team at Prime Health. The advice from that multidisciplinary team, or MDT, is that MRI is really the gold standard in having a look at the prostate. We have two options. We have the gold standard, very detailed option called the multi-parametric MRI. That requires contrast, which is giving a bit of dye via the vein. It's a more expensive scan, but it's incredibly accurate, and it can look at very detailed lesions should we need to. The other type of MRI scan we have is called the biparametric, and that's it's an MRI scan, and it can pick up significant lesions. It's just not as accurate as the multiparametric. I think it's important to say that as general practitioners, as GPs, I think we're very good at knowing a lot about a lot, but when we need to investigate something further to do with the prostate, we have our consultant urology colleagues on hand to take things further and really lead that decision making.
And can I arrange those scans without having an appointment with the GP?
Yes, you can. My recommendation would be to always reach out to a GP first. And that's for a few reasons. The first is you may not need a scan. So it may be the case that we can do a lot of reassurance with history examination and blood tests, and you don't need to use those resources to get a scan. That's the first thing. The second thing is, I think that I really value continuity of care and talking to a human being through my own personal health. And I think having a trusted, learned doctor to talk you through this process is really important. But if you wanted a scan and just didn't want to have a consultation with a doctor, yes, you can self-book some of those MRI scans. They're all reported by a consultant radiologist, so a very experienced imaging doctor, and you will get that report, and you will also receive with it some guidance as to what to do next. So for instance, if something is found on a scan, we will give you a recommendation, or someone will pick up the phone and say, this is what we would recommend next given this result.
Finally, Cam, a question really for the ladies. Clearly we don't have prostates, but we often love people who do. And we know they are sometimes less keen on visiting doctors. How would you help us to encourage our men to visit the doctors if we have concerns about their prostates? How can we reassure them?
Look, I think first and foremost, the statistics show that men are less likely to reach out for healthcare advice. We know that, and that's not exclusive to prostate health. That's across all of the different sectors in healthcare. So I think if you're worried about a loved one with a prostate, so to speak, I would definitely have that conversation with them. We've shared in this little talk a bit of information. And although there's quite a lot to take in, I would say the first step would be to reach out and to start. And that can be something so simple as a phone call. You can book a telephone appointment with a GP, spending half an hour on the phone talking about what we could do, gathering some of that history. And it might be the case that we don't need to do anything in terms of next steps. But if we do need to, we can guide you through that. So whether you're a man or a woman, I would strongly offer you to get in touch with Prime Health and just ensure that your loved one, or whether it's yourself, your prostate health is looked after.
Excellent. And Cam, we can come to see you and indeed me at Prime Health in Weybridge and in Harley Street. That's right, isn't it? So
yeah, we've got a brilliant team of GPs. I think at last count we've got about 6 or 7 GPs in Weybridge, and we're building our team down in Harley Street. And one of the big taboos that I want to kind of break down a little bit is that if you feel more comfortable sharing this with a male GP, brilliant. But also women GPs are very well placed as part of general practice training to deal with prostate issues and prostate health. So I would strongly offer to you, it really depends on the person that you resonate with and connect with. And we've got a great team here that can help you.
Brilliant. Thank you so much for taking the time to chat this through with us. I'm sure we've all learned quite a lot.
Most welcome. And I mean, the final word from me really is just making sure that we really use those resources that we have at Prime Health. We're very well placed to, in one visit, sort everything out. So reach out to us and we can go from there.
Excellent. Thank you so much.